Early intervention is critical in addressing developmental delays or disabilities in children from birth to 3 years old and involves providing services and support to help these children reach their full potential. Here's why it's so important. A child's brain is most adaptable in the first 3 years of life. This period is crucial for establishing essential neural connections that shape learning, behavior, and health. Early intervention takes advantage of this plasticity, making it easier to address developmental issues and enhance learning. Intervention is more effective and less costly when provided earlier in life. Addressing developmental delays early can reduce the need for more intensive and expensive interventions later. Early intervention leads to better outcomes for children in various areas, including improved language skills, cognitive abilities, and academic development, enhanced social skills, emotional regulation, and reduced behavioral problems, improved motor skills, coordination, and overall physical well-being, and increased independence in their daily living skills. Early intervention offers numerous benefits for families, children, and communities. For children, early intervention improves developmental trajectory and overall well-being, increases self-esteem and confidence, reduces need for special education services later in life, and creates more significant opportunities for success in school and life. For families, it enhances parenting skills and knowledge, increases confidence in supporting their child's development, creates stronger family bonds and reduced stress, and gives access to a network of support and resources. For communities, it reduces the long-term costs associated with developmental delays, increases workforce participation and economic productivity, and creates stronger, more inclusive communities. If you have concerns about your child's development, don't wait. Talk to your child's doctor or another healthcare professional. Early intervention can make a real difference. Here are some resources that can help. The CDC's Learn the Signs, Act Early program at www.cdc.gov/ncbddd/actearly/index.html. The Early Childhood Technical Assistance, or ECTA Center, at https://ectacenter.org, and the American Speech Language Hearing Association, or ASHA, at https://www.asha.org. Collaborating with families is absolutely crucial when identifying risk factors and creating effective intervention strategies for young children. Here's why. Families know their child best. They have intimate knowledge of their children's strengths, challenges, behaviors, preferences, and developmental history. This information is invaluable for gaining a holistic picture of the child. Families provide crucial cultural context that can influence a child's developmental and how they respond to different interventions. Understanding cultural values, beliefs, and practices ensures that strategies are respectful and effective. Parents and caregivers are often the first to notice subtle developmental differences or concerns. Open communication and collaboration with families allow for early identification of potential risk factors. Families can provide detailed information about their child's development across various settings, home, the community, or other, leading to more accurate assessment of needs. When families are actively involved in developing intervention strategies, they are more likely to be invested in implementing them consistently and effectively. Family collaboration allows interventions to be integrated into the child's natural environment, such as their home, routines, and others, promoting generalization and long-term success. Strategies can be tailored to the family's specific needs, resources, and preferences, making them more sustainable and relevant. Collaboration empowers families by giving them a voice and valuing their perspectives. Working together builds trust and strengthens the relationship between families and professionals, leading to better outcomes for the child. Families feel supported and less stressed when actively participating in their child's care. When families and professionals work together, children benefit from a coordinated and consistent approach to intervention, leading to improved developmental outcomes. Collaboration promotes a sense of teamwork and shared responsibility, increasing the likelihood of success for the child. In conclusion, collaborating with families is not only beneficial, it's essential for identifying risk factors, developing effective early intervention strategies, and ultimately supporting children's healthy development. There are some obstacles to early intervention, including lack of awareness. Families may need to be informed about the signs of developmental delays or the availability of early intervention services. A solution includes increasing public awareness campaigns, providing information in accessible formats such as multiple languages and visuals, and utilizing community outreach programs. Sometimes there is late identification. When there is late identification, developmental concerns may need to be identified early enough, delaying access to services. The solution is to improve developmental screening procedures, train primary care providers to recognize early signs, and encourage families to voice concerns promptly. Sometimes there is limited access to services. Families may face barriers such as long waiting lists, limited service availability in their areas, or lack of transportation. Some solutions include increasing funding for early intervention programs, expanding service locations, offer telehealth options, and provide transportation assistance. Often there is financial constraints. Families may struggle to afford services, especially if they lack insurance coverage or face high copays. A solution includes in advocating for policies that increase affordability and access to insurance, explore sliding scale fees, and connect families with financial assistance resources. Obstacles to family collaboration include lack of trust. Sometimes families may be hesitant to share information or collaborate with professionals due to past negative experiences, cultural differences, or fear of judgment. A solution includes building rapport through active listening, respectful communication, and culturally sensitive practices. Clearly explain the benefits of collaboration and ensure confidentiality. Sometimes there are communication barriers, including language barriers, different communication styles, or lack of clear information that can hinder collaboration. A solution includes providing interpreters using plain English and visual aids, offering information in multiple formats, and establishing regular communication channels. Sometimes there is conflicting priorities. Families may have competing demands on their time and resources, making it challenging to participate in interventions. A solution includes offering flexible scheduling options, supporting childcare or other needs, and integrating interventions into daily routines. With differing perspectives, sometimes their professionals and families may have different views on the child's needs and the best approaches to intervention. Solutions include fostering open dialogue, encouraging shared decision making, and common ground through compromise and collaborative problem solving. Overcoming challenges include systematic change, advocating for policies that support early intervention and family engagement, increasing funding, and improve access to services. Training professionals in culturally responsive practices, family-centered care, and effective communication strategies. Collaborating with community organizations to provide comprehensive support and resources for families. By proactively addressing these obstacles, we can create a system that supports early intervention and empowers families to be active partners in their child's development. Other resources available include American Academy of Pediatrics, the AAP.org, the Division for Early Childhood of the Council for Exceptional Children, the ECTA Center, Individuals with Disabilities Education Act, the National Association for the Education of Young Children, and 0 to 3.